Would you like to know how to stop tooth decay and save yourself thousands of dollars in dental bills? Well, the good news is that you can, because your teeth are not designed to decay. They were designed to remain strong, resilient, and cavity-free for your entire life, just like your bones. Cavities in children is a huge problem nowadays, but when I raised my babes, their teeth didn't rot. Their baby teeth became loose, they fell out, and new teeth came in. I did not need to take them to see a dentist. But nowadays you have children's dentistry, which is a huge money-making business. Today, many people need braces because of crooked and overcrowded teeth. 85% of people have to get their wisdom teeth pulled because there's not enough room in their mouth. But why would God give us wisdom teeth that need to be extracted? Does that make sense to you? Today, most adults have amalgam fillings, which contain 50% mercury, and mercury leads to poor tooth and bone health. If a mom has a lot of amalgam fillings when pregnant, then the mercury is transferred to her child through her placenta and breast milk. So just because your children don't have amalgam fillings doesn't mean they're not mercury toxic. I would like to share with you a true story about Dr. Weston A Price. He was a Canadian dentist from the early 1900s. So between 1920 and 1930, he noticed a dramatic increase in cavities and crooked teeth amongst his patients, and he wanted to know why. So he shut down his practice and he traveled around the world to study the health of different indigenous people groups. And he found groups of indigenous people who had not been exposed to processed foods like white flour and sugar, who did not use toothbrushes, and yet they had 0 cavities. Their teeth were in excellent shape. They were straight and beautiful with enough room for even their wisdom teeth to come in. And in his book, he gives many examples of excellent native teeth. And here are pictures. And as you can see, their teeth look beautiful. But whenever indigenous people were fed a white man's diet of processed food, cavities were rampant. It destroyed their beauty. They couldn't chew their food properly. It caused poor digestion and absorption of nutrients. And here are some pictures of isolated Swiss Alps children with amazingly healthy teeth. And here are some examples of isolated Swiss Alps children exposed to Western diets. And as you can see, their teeth are decayed and they don't look so pretty. So those were some long ago examples. But now I would like to introduce you to a modern day example. Layla is a good friend of mine, and her mom was born in Fiji, which is an isolated island way out in the middle of the Pacific where they eat a more indigenous diet.
Hi, my name is Layla. I'm 24 years old and I'm from Calgary, Alberta, Canada. I've never had my wisdom teeth taken out. I've never had any cavities. I've always had really straight teeth. I never needed braces. I've never had any dental problems. I only go to the dentist once every 3 years or so, and I've never had any problems. I think the reason why I've had such great teeth growing up is because my mom always forced me to take vitamin D drops, which are great for calcium and just having strong bones. And I think taking those my whole childhood and growing up to my adult life has been the reason why I've had really strong teeth.
It is very important for women to start taking these supplements while pregnant for the proper development of baby's dental arches and teeth. And then you want to keep supplementing them as they grow up to spare your child the pain of braces, wisdom teeth, extractions, and sinus problems, and save yourself a ton of money. It's just a win-win.
Now, I also have an example. When I raised my 4 children, I did not know all that I know now, but I limited their sugar and processed foods while supplementing their diet with whole food nutritionals. Now, I'm happy to report my 2 oldest have 0 fillings, and my 2 younger ones have 1 or 2 each. While my husband and I, on the other hand, I had 12 and he had 16 fillings. And as you can see, that is a huge difference. And I believe that it was the restriction of sugar and processed foods along with key supplements that made the difference in our children's teeth. But most dentists will tell you that in order to prevent cavities, you need to brush your teeth more, which is good. I'm not arguing that fact, but that is not the whole story, because the indigenous people's healthy teeth is proof that diet is the most important factor in preventing cavities, because they never even brushed their teeth and yet they had excellent teeth. So decay is not so much caused by sugar sitting on teeth, but rather by too much sugar and refined foods in the diet, which causes the minerals to leach out of the teeth, demineralizing them and weakening them so they are less resistant to the bacteria, which then cause decay. So for 10 years, Dr. Weston A Price and his wife studied the diet of these isolated people groups to find out the secret of their healthy teeth. He was so excited about his findings that he came back to Canada and reopened his dental practice to see if he could replicate his findings. He actually took a group of children whose teeth were already decayed, and he fed them one good meal a day along with specific key supplements to remineralize their teeth. And then they went back home and they ate what they would normally eat at home. And to his delight, he was able to stop the decay, proving that tooth decay could be reversed with diet and supplements. So, what are the secrets to healthy teeth? Now, I am not advocating exchanging modern day conveniences for a primitive lifestyle in order to have excellent teeth, but there are a few simple things that you can do to greatly reduce your cavities. Number one, reduce processed food like candy and pop. That should be no surprise to you. Number two, take a few key supplements that will remineralize your teeth and bones. Number three, brush with a healthy non-fluorinated toothpaste and floss 2 to 3 times daily. And number four, replace your amalgam fillings and detoxify. Now, you may not be able to follow all of these recommendations immediately, but if you decrease your sugar intake and begin taking the supplements that I recommend, then you should see a dramatic decline in cavities. Now, here is a short list of the most important nutrients for remineralizing your teeth. Fat-soluble vitamins A, D, and K2.
Oral magnesium supplements will be discussed later.
And magnesium chloride in a liquid spray or lotion. Research has shown that most people are deficient in all of these nutrients. And this deficiency causes problems with calcium assimilation and development of bones and teeth. Vitamin D actually acts as a catalyst to transport calcium into the teeth and bones, and vitamin K2 keeps it there. So, if you are prone to getting cavities or have sensitive teeth or inflamed gums, then this is an indication that you are very deficient in vitamin D and K2. But the good news is that it's easy to correct with the right supplements. So when I first learned this, I got my vitamin D levels checked and my doctor said they were very low. And he gave me a bottle of vitamin D in dry capsule form. And he said they don't work, and he didn't know how to raise my vitamin D levels. Today I know why, because he used the wrong type. Vitamin D is actually a fat-soluble vitamin, meaning it is best absorbed in an oil form. Dry capsules are pretty much useless. So when I began taking a fat-soluble vitamin D, my levels rose above normal very quickly, and my doctor was actually amazed. And he actually wanted to know what I was doing. Now there are two options that you can get, synthetic or natural. Now some forms of vitamin D are made with lanolin, which comes from sheep wool. And some are made from cod liver oil, which is processed in such a way that the naturally occurring vitamins A and D get destroyed. So they have to add a synthetic form of those vitamins back into the oil, which they don't tell you about on the bottle. And synthetic vitamins are said to be an exact copy of the natural vitamins. So here are examples of synthetics that you can purchase at your local health food store. And these oily-based synthetics tend to be highly concentrated in very small quantities, so use as directed. Now my preference is a natural whole food form of vitamins A, D, and K2, which comes from a fermented cod liver oil / concentrated butter oil that is made by a special fermentation process whereby the oil is extracted without heat, preserving the naturally occurring vitamins A and D. And they also add concentrated butter oil, which is high in the vitamin K2. Now, it's available as a paste or in capsule form for those who are sensitive to fish taste. And the nice thing about a whole food supplement is that you can't overdose because it isn't synthetic. Magnesium is also required for building strong teeth and bones. And magnesium deficiency is very common, and it's also very easy to correct. Some of the symptoms include muscle and facial twitching. You know, sometimes when you get that involuntary eye twitch that you can't stop, that's a magnesium deficiency. Things like muscle cramps, charley horses, aching legs, growing pains, restless leg syndrome, angina, rapid heart rate, high blood pressure, and insomnia. And these symptoms, they can be strong enough to keep you up at night. You might have attributed these issues to calcium deficiency, so you up your calcium supplementation. However, this ends up further depleting you of magnesium and can make things worse.
There are a number of options for magnesium supplements, and your preference will depend on your situation, of course. Magnesium citrate is popular and helps relieve constipation, but too much can cause loose stools, so you just want to cut back if that happens. But if your digestion is sensitive or you're prone to loose stools, then magnesium biglycinate is a better option. Magnesium malate and magnesium orotate are also good options. But stay away from CalMag, magnesium oxide, and magnesium stearate.
And I also like it in a liquid spray or lotion. And the great thing is you can rub it on your skin so it's absorbed right where you feel the discomfort. And the best time to apply this is right after a bath or a shower when your pores are wide open. Now, I do not recommend calcium supplementation because it can deplete your body of magnesium. And a lot of people are allergic to milk products nowadays because of mercury toxicity. I'm not saying that milk products are bad. I just want to make you aware why some people have allergies to milk products, because mercury interferes with the assimilation of calcium. There is lots of excellent calcium found in most food sources, and there's no need to supplement. And last but not least, I recommend using a healthy herbal toothpaste. I use one that is non-fluorinated, made with all natural ingredients. Now, I'm not sure if you are aware of this, but Colgate and Crest have warning labels on their packaging saying that if one swallowed this paste in large quantities, it is poisonous. Hello? That's why I prefer a natural toothpaste with essential oils that is safe enough to swallow. So what is your dental bill every year? Here are some estimated dental costs for children. And in this example, a child's dental bills could be over $5,000 per year. That's an ouchie, right? And I also have an example for adults, which can be over $7,000 a year, depending on what you have done. And in 5 to 10 years, it can easily cost $35,000 per person when implants are chosen. So as you can see, my friend Layla was able to avoid all of these dental costs through a simple prevention program. And this is why I encourage you to take the steps outlined in this video and save yourself a lot of money and have healthy teeth till you're 120 years old. So if you want a list of the recommended products, then click the link below. I hope that you have enjoyed this presentation. Please give me a like and leave me a comment if this has helped you. This is Kathleen Dorn helping you take care of your teeth.